The next section, we have the clinical microscopy. This section is a specialized area that focuses on microscopic examinations and analysis of urine, stool, and other body fluids. Its purpose is to detect irregularities and cellular abnormalities that help support accurate diagnosis and treatment planning. So, tests done in clinical microscopy. First is the pregnancy test, wherein it checks urine HCG to confirm pregnancy. Next is urinalysis, where examines the physical, chemical, and microscopic parts of the urine to assess kidney health, hydration, and infection. Next is the urine micro test, where it measures microalbumin in urine for early detection of kidney damage and especially in diabetic patients. Next is urine bile test, wherein it detects bile pigments in urine that may show liver problems or bile duct blockage. Next is urine ketone test, wherein it identifies ketones in urine. Next is urine urobilinogen test, where it checks urobilinogen levels to help evaluate liver functions and detect hemolysis. Next is phasalysis, wherein it examines stools for parasites, blood, and mucus. Next is the semen analysis, wherein it evaluates sperm count, motility, and shape to assess male fertility. Next is cell count of body fluids, wherein it measures cells in CSF and inflammation or cancer. Lastly is the wet smear for trichomonas, where it identifies trichomonas organisms for diagnosing trichomoniasis. Okay, so for the standard operating procedures, we also have the pre-analytical phase, wherein we collect, label, and transport and inspect all urine, stool, and body fluid samples, and followed by the analytical phase, wherein we check the color, clarity, and volume using centrifuge specimens and examines under a microscope, performing staining, some cell counting, and identification of microscopic components. Lastly is the post-analytical phase, wherein we interpret results, verify accuracy, and release findings.
Hello. So
Hello.
additionally, we are in this section is the pathologist office. So this is where the pathologist usually stays. And additionally, the chief medical technologist also stays in this general area. So basically, this is where they verify and document all the results that comes from the clinical laboratory. So now moving on to the microbiology section.
Hello. I hope everyone's able to hear me well. So, good day, everyone. I'm Joshua D. Payos, the head of the clinical microbiology section, and today I'll be explaining what our area of the laboratory does and why it's essential in patient care. Now, the clinical microbiology section plays a vital role in identifying the microorganisms that causes infection and guiding doctors towards the right treatment. In this area of the lab, we perform culture and sensitivity testing, microscopic exams like gram staining, and serological tests that detect antigens or antibodies. Now, like other sections of the lab, we have a strict SOP. This begins with proper specimen collection and labeling, making sure each sample is taken from the correct site, placed in the right container, and labeled with complete patient details. After collection, specimens are transported and received safely, maintaining the correct temperature and avoiding delays that could affect microbial growth. Next, samples are processed in the lab, which includes assessing specimen quality, preparing smears for microscopy, and inoculating them onto the appropriate culture media. The plates are then incubated under the correct conditions, a specific temperature, atmosphere, or time, depending on the suspected microorganism. Now, once colonies grow, organism identification is performed using a combination of colony morphology, gram staining, biomechanical tests, and automated identification systems. After identification, antibiotic susceptibility testing, or AST for short, is done using standard methods like disk diffusion or automated instruments to determine which antibiotics the organism is sensitive or resistant to. Now, throughout the workflow, quality control checks are applied using control stains, monitoring media, and verifying equipment performances. All results are clearly documented, with critical or life-threatening findings immediately reported to the physician. Finally, biosafety measures such as PPEs, proper waste disposals, or regular decontamination are strictly observed to maintain the safety of both staff and patient.
Hello? Before we move forward with the 2D floor plan and also the 3D model of our clinical laboratory, you may be wondering why we don't have the sections histopathology and blood banking. So I'll be here to explain the reasoning as to why we only have 5 sections in our tertiary laboratory. According to the Department of Health Amendment Order number 37, series of 2021, the requirements of a tertiary laboratory only include the following sections, which is clinical microscopy, clinical chemistry, hematology, microbiology, and immunology and serology. There is a specific test, however, that is part of cytology there, which is Papi-Nicolau smear. However, it is not required that a freestanding tertiary laboratory has a specific room in order to perform Papi-Nicolau smear. So in particular, it is also stated in the Department of Health Department Circular 0197 series of 2024. It states that if laboratories are unable to set up histopathology sections, or basically cytology sections within their laboratory, they may be able to uh, partner with another DOH accredited facility in order to provide those services. So basically, what I'm trying to come across or try to say is that usually histopathology is not really that common within a freestanding tertiary laboratory because, first of all, it is pretty much hard for doctors to transport autopsy and biopsy samples or tissue samples to a laboratory because there is also a possibility of infection or damage with the tissue samples. So that is why usually histopathology is part of hospital-based testing. However, uh, Papi-Nicolau smear is also one of the tests that we could do in this laboratory, in particular with the staining rack in our hematology section. In particular, blood banking is also not part of our clinical laboratory as it is not defined by DOH as something or as a minimum requirement of the tertiary tertiary clinical laboratory because for it is also because in general it is uncommon for a freestanding laboratory to keep or become a blood center because first of all blood is a very rare resource. It is also very perishable, and having a blood banking section in the laboratory requires specialized experts, which requires a lot of money to upkeep. So this is why, for these reasons, we decided not to include histopathology and blood banking, for they are mostly hospital based. And we also followed only the Department of Health Amendment Order number 37, series of 2021's recommendations on what a tertiary freestanding laboratory is. So we will now move forward to our 2D floor plan.
Okay, I'm Lucilia, and here's a picture of our 2B floor plan. As you can see, the lab is isolated from the area to prevent any risk of contaminating the patients with a potential pathogen. In the laboratory, the sections are placed next to each other with sections that use similar samples grouped together in the same spot for efficient workflow. A separate entry point is allocated for the staff and as well as a fire exit in case of emergencies. For any issues in testing or results, the office of the pathologist is easily accessible and available.
So lastly, for the staff pantry area. So the staff pantry area is designed to support laboratory safety, hygiene, and workflow. It includes 2 bathrooms, a locker area, a shower room, and a back entrance connected to the staff parking area. Because these spaces act as the controlled transition zone between outside environment and the laboratory. So for the detailed explanation, for the 2 bathrooms for male and female, the staff pantry area includes separate bathroom for male and female bathroom to ensure privacy, comfort, and convenience for all staff members. In a laboratory setting, maintaining hygiene before entering work areas is implemented. And this bathroom provides a clean space where employees can wash up before or after performing tasks. The separation also follows building and health regulation that requires specific facilities, and especially in medical and laboratory environment. For the locker area serves as a secure space where staff can store personal belongings and change into proper laboratory attire. Since laboratory requires strict contamination control, staff cannot bring outside clothing, gloves, and items into testing rooms. For shower room, the shower room includes for safety and hygiene purposes. In a laboratory that handles chemicals, microorganisms, and other hazardous materials, accidental exposure or spills can occur. The shower room provides a place where staff can wash off contaminants to prevent harm and reduce the spread of hazardous substances. For the back entrance from staff parking, the staff entrance located at the back near the parking lot is designed to give employees direct and controlled access to the laboratory facilities. This prevents staff from passing through public or patient areas, reducing the risk of cross-contamination.
Hello. Hello. So before we end with our presentation, I would like to show a close-up version of our 2D floor plan so that it will be easier to understand. So here is our 2D floor plan. So here is our entrance, wherein this is our reception area. In the first desk is the receiving and releasing of results, and the other one is the cashier table. Down this hallway is our public bathroom, and to the left of it is the specimen collection area, or also phlebotomy. As soon as you enter through this door, there you will be greeted by a sink so that you can wash your hands prior to entering to the clinical laboratory. In particular, a PPE closet is also in this area. Then, in our clinical laboratory here, as you can see, it is arranged in this order: clinical chemistry, hematology, immunology and serology, clinical microscopy, and microbiology here on top, and also the pathologist office. So I'll also show off the equipment here in each section. So for clinical chemistry, we have a chemistry analyzer and water bath. For hematology, we have a hematology analyzer, microhematocrit centrifuge. For immunology and serology, we have an immunology analyzer and coagulation machine. For clinical microscopy, we have a water bath and urine strip analyzer and a centrifuge. And also to the end of this hallway, I forgot to add, is our waste holding area. So basically, this is where all of the waste in the laboratory is first kept before proper disposal. And here we also have a fire exit just in case of emergencies. And also near that is the emergency showers. So in cases of fires or accidental spillage, you can go here. And then the storage room is where we keep most of the reagents. So that is why there's a refrigerator here. And for the microbiology section, you first enter through the decontamination room prior to entering through the microbiology culture testing area. So here we have an autoclave and a PPE. And then when you enter, there's a microscope, a biosafety cabinet, a centrifuge, and an incubator. And for the media preparation room and sterilization room, we have ref, hot plate, digital weighing scale, autoclave, and dry oven. So basically, in the microbiology section, it is important that you enter one way and exit through another so that you will not be contaminated. And through this door, you go to the staff pantry area, basically the staff resting area, and then we have the male and female restroom and the employee parking. And also, additionally, these are the measurements here. The measurements here are in meters. So generally, the clinical laboratory is around 200 square meters in total, not including the employee parking. That is all for our presentation. It was quite long, but I hope that you gained some insights on our laboratory. And hopefully we discussed properly, specifically about our 2D floor plan, our 3D model, why we pick those sections and whatnot. And here are our references. So that is all, and thank you for listening.